sorry, didn't see you there. Welcome to the Nightcap. We're having a spa day with the ladies. Yes, it's a girls' night, and we're talking self-care, not just massages in the spa. We're talking sexual health, honey, medical and mental. So let's get into it.
Yeah, what's up for a nightcap? Chill, you know, kick back.
All right, before we go back to relaxing, we're gonna get into the talking. I've got my girls here. We got Cindy Bourbano in the building. We've got pelvic floor physical therapist, Dr. Momawa Bork. And we've got relationship and sex therapist, Dr. Viviana Coles. All right, sexual health. I mean, women, I feel like, really tend to shy away from it, don't talk about it. Some girlfriends do. I'm the one.
We're with each other, yes.
Like, did you do this? Did you do that?
Right.
But I'm surprised at how many women really don't even take it into consideration on their overall health.
Yeah, I think for a lot of women, they're struggling to, like, where are the priorities, right? And it's almost like if you can't see it, then you don't really pay attention to it. And so that's why it's so important to have a skintimate. I said skintimate. That works. Skintimate care routine.
Yes.
A intimate skincare routine, especially, but just in general, to take care of your body, even your nether regions that you don't take a look at every single day. It's so important to pay attention.
And you should take a look at it. I mean, Dr. Bork's been here, and she'd be like,
the
get that mirror
out of my open it up if I wasn't wearing this dress and take a look, because for so many reasons, medically, there's so many things that people experience. I can't tell you how many times I've been working with a patient and they get so nervous because they felt pressure and they felt something between their legs, and now it's a prolapse. But maybe it's not, it was just tissue that's been slowly descending, and and all of a sudden now it's a thing that you've got to fix. But if you kind of are ahead of it, it's not so much of a problem.
And I'm glad you're telling me that, doctor, because I think as women, and maybe it's like a cultural thing too, it's like it's very taboo. You really don't touch, you really don't see, you don't talk about it. Even if you do feel like things are going on, you're supposed to be really quiet about it. Maybe you go once a year to see your doctor, but it's still embarrassing. Like I don't know why there's a shame behind knowing our bodies.
Yeah, I mean, honestly, I feel, historically speaking, communication about the sexual organs is always a more taboo topic. And I think it's so important, even from young age, that children know what their body is and know the words to it, because you can't walk around calling it a cookie. I've said this before. You can't call it a cookie, because sometimes if there's an issue with it, then you don't know what the person is saying, or the terminology for
even
it.
if you do know the term, there's so many women that use the word vagina for everything, including like the vulva. Like, it's the vulva, people, vulva. And for a lot of women, I do think that it's taboo because our sexual pleasure has been put aside for so long. So us needing to know about our bodies hasn't usually been the case, but we're changing things. We are changing things.
Yes.
And on the Nightcap, baby, we talk sex.
Trailblazer.
Okay, so, and there are women who don't go to their gynecologists or who don't even know who the doctor is that's gonna deliver their baby. So how do we begin that communication with ourselves and then with the professionals?
Honestly, I think it's really important that because some people want to wait till they're already having sex, or the first time they've gone is because they had a positive pregnancy test, but just going to get a checkup to make sure that you're not developing, even from your cycle standpoint. People don't realize that sometimes their pain that they're experiencing from their cycle isn't really common or normal. You shouldn't.
Take an Advil because we're being, put a hot pad. It's okay, deal with it.
Be fine.
So what would you say is the age that we would?
Before you say that, when did you actually go for the first time? What age?
To like the gynecologist. I think I was probably 19.
19, doctor.
Yeah.
I was probably like 19, 20.
But what's the age that you would
16.
say that we should start going? Like, I have a 7-year-old daughter. When is that moment that I need to be like, okay, we need to have you checked? What's appropriate?
Well, for instance, I honestly think around, what is it called? Not menopause.
When you get your menstrual cycle?
Around menses.
What's
around,
menses?
What's that?
Okay, so when you start your cycle, the first time you actually, menarche.
So maybe
when
like
you start your
12,
cycle.
13, 14.
I mean, but some
Yes.
people start very young. I started very young, and so
yeah.
I went to gynecologist when I was still in elementary school.
Well,
Yeah.
an internal
And then there are some who
wow.
don't get their period until they're in their 20s.
Yeah.
So you should
but
wait
having
whenever.
an internal exam versus, if
What
you
does
go to
that
the
mean?
pediatrician,
An internal?
they're going to check your external genitals, and they're going to check the area with a parent is in the room. They always do that. They should always
Right.
be doing that.
Right.
But for internal exams, that's something that may not happen until you tell them you either want it to happen, and then you might even have to justify it.
Now, internal work is mostly just when they're physically looking inside of the vagina and seeing what your organs and tissue looks like. Is it healthy?
Right.
What's going on with that? But you can opt to have that done as an adult, but even if you went in, there's a lot that can be done for just visualization, discussing sexual health concerns or questions you might have, so that you can start having those conversations and be more in knowledgeable whenever it comes time to your relationships with your partner.
Ooh,
Or even with yourself.
We're gonna have to talk about the relationship with ourselves and with our partners. All right, we're talking sexual health. You stay right there. We'll be right back. We've got every episode of the Nightcap, and we can go for hours. Download the Fox Local app on any of the following smart TV platforms and get in on the fun. Welcome back to the Nightcap. I've got the ladies in the building. We've got Cindy, Dr. Mamawa, and Dr. Viviana. We've been talking about sexual health and what we should be doing, going to the doctor at the menarche, which is when you start your period.
And the menses.
And
Your
the
menses is your menstrual
Something
cycle.
like
yeah.
that.
We
And
learning.
vulva. Everybody, vulva.
Vulva.
It's not just a vagina.
No.
Right, I feel like I always call it vagina, but the vulva. Okay, so now let's talk about the pleasure and the communication with a partner, right? So when sexual health and bringing somebody else into it, how do we navigate that?
Hey, I'm right here. So
I
I
knew
think
my
when it
line of
comes to
sight.
pleasure, it's so important to ask your partner, hey, this is what I typically have liked. Do you want to try that? Or even just asking them, like, I trust you. I want to just let you explore. What do you want to do? Asking whether it's with toys or their hands or their mouths or even with just talking about it can be very sexy. You don't, just because you talk about it doesn't mean you have to do it. And just because you do it doesn't mean you have to ever do it again. So just exploring with your partner and figuring out like what feels good, because you just never know, especially because even though we all have human bodies, it doesn't mean that we experience them the same depending on where you are in your menses.
Yes.
And that's an important conversation to have, especially if you're a woman.
And I think that has a lot to do also when you have these conversations with like girlfriends, for example. They're like, oh, I've never had an orgasm. He doesn't know how to touch me. Oh, I'm straying away. And all of a sudden they're having relationships with other people because those people, and all I can think about is like, have you told them? How do you like to be touched? What is it that excites you? What is it like, are we having these conversations? And they're not. I don't know what it is about a lot of women or just men or relationships in general that they don't like to vocalize. They don't like to say like, don't touch me. I don't like that. That's maybe you like, I'm not into that, but I like this and let's do that. And when we don't say it, we will not get the best pleasure or the best experience. A lot of women, also friends of mine that I've had conversations where I hate sex. I'm like, what?
Yeah.
What are you talking about?
Right.
Well, so that
they do.
That reaction though is one of the things that happens in the office where people will say, I don't want to share that I've never orgasmed, because they're worried that either their friends will be like, oh my
me,
gosh, you're
what?
missing out. What's
The
wrong
Cindy
with
going
you?
on.
Okay, so I do have someone who's very close to me who has said that she's never had an orgasm. And it was in the group chat and we reacted that way, like, what in the world? And I was like, girl, come on. Get that shower head. Okay? Go get that dildo.
You told me about that.
Like, go
tried it.
explore. And?
Yes,
I'm telling you.
yes.
The shower head. I'm
Things
telling
you
y'all.
learn on the Nightcap.
Listen.
But being
Very
able to
educational
tell your
here.
partner, like, hey, I tend to orgasm this way, or I've never orgasmed in this way. That's a very common thing.
Yeah.
Less than 20% of women, usually sometimes closer to 10% of women actually orgasm from internal stimulation. So this whole like penis, vagina, intercourse thing doesn't usually do it for both parties. And that needs to be normalized and it's okay.
Part of the reason why a lot of people don't enjoy sex or like sex or like, I don't want to have sex, is because it's uncomfortable. And if it is uncomfortable for them, is it uncomfortable or are you having pain? And if you're not communicating these things.
But can you have pain during sex?
Oh, yes. Most of my patients have pain with sex.
Like physical?
Physical pain. Because we have muscles that live inside of our pelvis, and those muscles work just like the muscles in our shoulders, and so they can have tender points just like you can have tender points in your shoulders.
Oh, wow.
Like there's so many patients that come see me that have pain with doggy style, and they're like, we can't do that, that hurts, I don't want to do anything like that. And and then maybe
And
that's
with
the
you,
partner.
They might be able to find.
And after they've worked with me, then they're like, not a problem anymore, because it's a physical thing that can get better.
Oh, wow.
But I feel like people put that off. Like, you know, maybe sex is just painful and that's it. They don't think of finding a solution.
Yeah.
Right.
Or
And they
there's
can't.
a
They
very
can't.
common issue, rare in the grand scheme of things, but more common, is vaginismus. And that's where it's the involuntary contraction of the outer third muscles of the vagina. So the lowest part of the vagina, it's involuntary. So we have to work through a lot of the anxiety that's causing that.
What is vaginismus? What is it
meaning
doing?
meaning it's almost like it's a brick wall, and there's nothing that
can't
is going to penetrate it. And of course,
it's like tensing.
Yes,
and
it
then-
can
but
be.
it's not conscious. It's something that's basically always
Subconscious, like a
happening.
guarding.
And a lot of that, it is a mental health disorder that we need to work through. So a lot of people don't know that. They just think, oh, I have a small vagina.
But they don't know they have
But
this.
they don't realize it until they have a partner who's like, I can't
feel like
even
it's
do
like
anything.
hitting a wall.
Or I can't even put a pinky or a finger, and we might start with like a Q-tip or things like that. And it just
small as a Q-tip.
Yes. And there's tools that we use to help with insertion. So it comes from like this tiny and it goes all the way to the size of the penis.
Okay, so this is going to get a little aggressive. So graphic. When you see, you physically know that nothing can get in there. Like if you were to try to do this.
that much.
When I do an
closes?
assessment, it will close.
Wow.
And I've had patients
For a
where
Q-tip?
Oh yes, because it's like she said, there's
it's
a
an
guarding
involuntary.
mechanism.
You're and a lot of times I can tell that it's like you have anxiety because that's part of it. It could be from trauma. It could just be from getting different messages about sex and pleasure or femininity or whatever. And it could also be worsened by a partner not being able to communicate well about sex in general. Sometimes it can get worse. Fortunately, there's help. You can absolutely get to a better place.
We got to talk about this help. All right, you stay right there because we got to figure out how to find the solutions when we start thinking something's wrong. All right, you stay right there. We'll be right back. Welcome back to the Nightcap. We've been talking to the ladies about our sexual health, right? Because it's important.
Very,
Okay.
important.
Clearly, there are a lot of things that women can go through that they need to go see a professional for, and they may be shy about it. So obviously they need to explore themselves first, right? Yes. And then when do they take the steps to go? See, I know I do, so it's hard to come from the perspective of someone who doesn't. So for those at home who are shy about it or they have a partner who hasn't gone, how do we encourage them to potentially go in?
Well, I would start off with, if sex is painful, you absolutely should go because
sex is not supposed to?
It should not be painful unless you want it to be. Like if that's your niche, if that's your thing, if you enjoy a little bit of pain with pleasure, there are some people that enjoy that. But if not, it should not be painful. And if it's painful with orgasm, there's people that have pain with orgasm, with clitoral stimulation. There's people that have pain with insertion. There's people that have certain positions. Yeah. And if any of those, if your cycle is excruciatingly painful, you should get that assessed because it should not be more painful more than 1 to 2 days. And if you're just in pain the entire time.
I know, and there are some partners who have come to me and their partners are like, she cries during sex and she just says, keep going, keep going. And of course, I'm like, my heart breaks for her, but she's like, but otherwise we're not gonna have sex and then we're gonna have all these relationship issues, right? The other piece of it is that there are times where penis might be too large. That happens. Some people are having trouble consummating their relationships because of that, that's something that you should absolutely get help for. We are pliable, but if it's that painful, you should definitely get help.
Wait, so hold on. Can someone who has a partner whose penis is too big for their vagina make their vagina so that it now fits? Is that what you?
Yes,
Yes.
they can. And usually in a therapy session, we would work on dilator training, which is where we use these dilators that look similar to a dildo, but they're medical tools that we use to kind of extend this way or expand this way. And even after a hysterectomy, where people have a surgery, they do have to suture the vaginal canal, and sometimes it can get more narrow. And then a partner that you've always had that didn't have a problem now becomes a problem.
Has a problem.
Or
So
if
you
somebody's
have-
transitioning, dilators are really important
Right.
during that time, and they do just that. Yeah.
Well, I have a question for the doctors. What about when a man's pH affects a woman's pH, which apparently can bring all of a sudden like these UTIs, or that they can bring weird smells, or even like different type of discharge because of a man? Does that happen?
It does. It does happen. And one of the reasons that it could happen is the female vaginal pH I would say, is between like 3.8 to 5. Men tend to be more basic. So in that,
Man, y'all are basic. Okay, y'all are basic out
Not
here.
only in life, but in their pH as well. Enough said. Okay.
and when that happens, you know, you can have a disconnect in the interrupting the pH of the vagina, increasing the risk of UTIs, yeast infections, using the wrong lubricant. Like if somebody uses lubricant that is heavy in petrolatum, which breeds bacteria, you can increase your risk of infection. So knowing clean lubricants that are really good for you, not using things like spit.
No, please stop that.
Yes.
They need to stop.
Yeah.
It's not sexy.
Not
it's
using-
not cute.
I mean, oral stimulation,
Not
yes,
cute.
I get it, but you have to
That's just gross. Bacteria.
Pee after.
Oh, yes.
Take a shower after,
Yes.
especially if it's a new partner.
Sorry. My husband and I, we like spit.
Well, that's how
we
that's-
going
But that's a
down.
whole play.
you know,
That's a whole different thing.
Okay.
Carol.
and it's
Just saying.
obviously working just fine. for
It's
us.
working fine, honey. That's all I got to say.
It's when you're getting symptoms and you don't really know why, and you're like,
Why?
I have this new partner. Oh no. It could be a whole slew of things
Yes.
that could very easily be remedied.
Yeah.
All right, for women and potentially men at home who want to learn more, I know you have an event coming up, right, Dr. Momoa?
I do. It's coucher and cocktails at Avant Garden. It is a Galentine's night, so that you know
So
the
the
ladies
the
feel-
guys got to stay home.
Yeah.
All right, just
that
for
way
the
we can have a
ladies.
continue
We're all
this
there.
conversation, right?
Yes,
Yeah,
yes.
February 15th at 6:30, and if you are free and in Houston, you should come. It'll be a good one.
Awesome. Okay, well, I know I left you ladies without a drink. That's because it's up to me to make it. So, coming up next, I'm backing that glass up. You stay right there. We'll be right back. Welcome back to the Nightcap. All right. We don't have a bartender in the building. Just kidding. There is one. It's me. It's time to back that glass up. All right, not gonna lie with you people at home, I am nervous, all right? Because it's always been fun and games when I'm behind the bar, but I've taken my first class thanks to the Cocktail Cowboy. He gave me a lesson or two on a few cocktails for dry January, and we're keeping it dry. You don't wanna stay dry down there, all right? You wanna keep that nice. I was gonna say the word moist. I said it, moist. But for this, dry January, we're keeping it refreshing and delicious with an East Side, okay? We're gonna be using Cut Above, which is a wonderful non-alcoholic spirit, and the gin is probably my favorite of the spirits that they have. And yeah, let's get into it. Okay, we're gonna start with about 3 slices of cucumber, yep, and then 5 to 6 mint leaves. Slap that. Get some wonderful essence in there. Bada bing, bada boom. Then we're gonna do 2 ounces of gin, if I could open it. All right, here we go. Good. Ooh, 2. All right, and then we're gonna do 1 ounce of the lime juice. That's they would scold me for that. That was not good enough. And then half an ounce of simple syrup. Bada bing. All right. Now, y'all know this is the one thing I can do is shake, baby. So I ain't worried. I ain't worried. I ain't worried. Y'all know what I'm worried about. I'm worried about opening it. Can I do it? I don't know, ladies and gentlemen. All right, somewhere around here is where I gotta slap it. It is so cold. That wasn't it? That was it. Second try. Second try, baby. All right, and then you wanna double strain this because, of course, we've got the mint leaves, we've got the cucumber. Ooh. Cheers. Let's see how well I did. Hey, hey, no one to verify me though. All right, Matt, I need to know if I did okay. Cheers to you at home. I'm gonna finish chewing this. See you guys next time. I did it.